to Med School Radio. We're going to be looking at some more Q banks, their summaries. We're going to go through them one by one and see if we can learn some things. Okay, let's start first of all with adult type coarctation. Patients with adult type coarctation of the aorta commonly die of hypertension associated complications, including left ventricular failure, ruptured dissecting aortic aneurysm, and intracranial hemorrhage. These patients are at risk for ruptured intracranial aneurysms because of the increased incidence of congenital baryaneurysms of the circle of Willis, as well as aortic arch hypertension. Next, remember that the blood-brain barrier acts as a permeability barrier in the CNS and is composed of capillary endothelial cells with tight junctions, basement membrane, and the foot processes of astrocytes. Damage to the BBB can lead to vasogenic edema, increasing ICP. Under normal circumstances, dopamine cannot cross the BBB, but its precursor, L-DOPA, can cross. Carbon dioxide, oxygen, amino acids, and glucose can all travel across the blood-brain barrier by different forms of transport. Okay, next. Chronic aortic regurgitation, or AR, causes a reduction in diastolic blood pressure and a compensatory increase in left ventricular stroke volume. These changes create a high amplitude, rapid rise, rapid fall pulsation, for example, a widened pulse pressure, and the other characteristic findings of AR, for example, head bobbing and pistol shot femoral pulses. Q fever is a zoonotic infection that occurs in farm workers exposed to waste from cattle and sheep. Its causative agent is Coxiella burnetii. A patient with exposure to waste from farm animals who develops a non-specific illness, for example, myalgias, fever, and fatigue for greater than 10 days, and retroorbital headache, with a normal leukocyte count, thrombocytopenia, and increased liver enzymes, should be evaluated for acute Q fever infection. What are pineal masses? Pineal masses typically manifest with symptoms of increased intracranial pressure as a result of obstruction of CSF flow by a space-occupying lesion. Pressure on the pretectal region of the midbrain may also result in Parinod syndrome, a condition characterized by vertical gaze and pupil abnormalities. Subacute and chronic subdural hemorrhages can present weeks after the initial exciting event with progressive headache, decreased level of consciousness, and lightheadedness. Diagnosis is through non-contrast head CT, which would show a crescent-shaped hyperdensity. Amiodarone is 40% iodine by weight. It can cause hypothyroidism due to decreased production of thyroid hormone. Amiodarone can also cause hyperthyroidism caused due to increased thyroid hormone synthesis or destructive thyroiditis with release of preformed thyroid hormone. CSF flows from the third ventricle to the fourth ventricle via the cerebral aqueduct of Sylvius. Obstruction at this level can cause dilated lateral and third ventricles with a normal-sized fourth ventricle. Obstruction at the foramen of Monroe would cause enlargement of only the affected lateral ventricle, while obstruction at the foramen of Magendie and Luschka causes enlargement of all four ventricles. Minimal change disease is the most common childhood nephrotic syndrome. Increased glomerular capillary permeability causes massive protein loss in the urine, for example, albumin. Hypoalbuminemia, can you pronounce it? Hypoalbuminemia reduces plasma oncotic pressure, which causes a fluid shift into the interstitial space, resulting in edema. Low oncotic pressure also triggers increased lipoprotein production in the liver, for example, hyperlipidemia. Lesions of the inferior frontal gyrus in the dominant hemisphere produce an expressive aphasia or Broca aphasia, in which speech is non-fluent but comprehension is intact. Contralateral paralysis of the arm and face with sparing of the forehead is common. Increased intracranial pressure caused by hemorrhage, mass lesions, or edema can lead to herniation. Uncal herniation is characterized by cranial nerve 3 palsy, oculomotor palsy, hemiplegia, and decreased level of consciousness. During the development of atherosclerotic plaque, or atheroma, activated macrophages, platelets, and endothelial cells release growth factors, for example, platelet-derived growth factor, that stimulate recruitment of smooth muscle cells from the arterial wall media and their subsequent proliferation into the intima. Procainamide and hydralazine have the highest risk of causing drug-induced erythematosus, lupus erythematosus, which is DILE, which is characterized by the development of lupus-like symptoms in addition to positive ANA and antihistone antibodies. Unlike with SLE, anti-dsDNA antibodies are rarely seen. Neisseria meningitidis is a gram-negative diplococcus that is a major cause of meningitis and sepsis. It can result in disseminated intravascular coagulation, shock, and adrenal failure, which is called Waterhouse-Friderichsen syndrome. Lesions of the subthalamic nucleus produce contralateral hemibolism, which is characterized by sudden, uncomfortable, and wild flailing and flinging movements of the limbs on one side of the body. Decreased inhibition of the indirect pathway of the basal ganglia is the mechanism by which this occurs. Okay, continuing on. Ornithine transcarboxylase deficiency is an X-linked recessive disorder of the urea cycle. A deficiency of this enzyme results in the accumulation of ammonia and carbamoyl phosphate. Hyperammonemia is neurotoxic and characterized by lethargy, poor feeding, irritability, and vomiting. Excess carbamoyl phosphate is shunted to the pyrimidine pathway and results in elevated levels of orotic acid. Guillain-Barré syndrome is an acute autoimmune demyelinating polyradiculoneuropathy that affects the peripheral nervous system, usually manifesting as ascending paralysis, loss of deep tendon reflexes, and autonomic dysfunction, often triggered by an acute infectious process. Treatment involves respiratory support and intravenous immunoglobulins or plasmapheresis. So more about Neisseria meningitidis. Remember that it's transmitted primarily by aerosolized droplets and subsequently colonizes the nasopharyngeal epithelium. Penetration of the epithelium can lead to bloodstream infection. Spread to the meninges occurs via transcellular penetration of the cerebral capillary endothelium or entry at the choroid plexus. Bacterial vaginosis is caused by disruption of the vaginal bacteria flora and is characterized by fishy-smelling, thin, grayish vaginal discharge and clue cells on wet mount microscopy. Metronidazole and clindamycin are the preferred treatment options. Beta blockers inhibit release of renin from renal juxtaglomerular cells through antagonism of beta-1 receptors on these cells. Inhibition of renin release prevents activation of the renin-angiotensin-aldosterone pathway, which results in decreased vasoconstriction and decreased renal sodium and water retention. Neurofibromatosis type 1 or NF1 or von Recklinghausen syndrome, Recklinghausen disease, is an autosomal dominant neurocutaneous disorder caused by a mutation in the NF1 tumor suppressor gene on chromosome 17. The presence of greater than or equal to 6 cafe or lay spots that are at least 5 millimeters in diameter in the pre-pubertal ages is considered diagnostic. Complications of subarachnoid hemorrhage include rebleeding, vasospasm, seizures, hyponatremia, hydrocephalus, and increased intracranial pressure. Vasospasm leading to delayed cerebral ischemia is the most common complication and often presents with new onset focal neurologic deficits 4 to 12 days after the initial subarachnoid hemorrhage.